Good afternoon to all of you. I'm Robin Grant, Director of Public Policy and Advocacy with the National Consumer Voice for Quality Long-Term Care, or Consumer Voice for short. For those of you who may not know us, we're a nonprofit national organization that works with and represents the interests of nursing home residents and other individuals receiving long-term services and supports. So I want to welcome you to today's webinar, which is being hosted by the Consumer Voice in coordination with the Utah Ombudsman Program and supported in part by a civil monetary penalty from the Utah Department of Health and Human Services. Next slide, please. So this webinar is part of a project designed to increase understanding of the nursing home transfer and discharge requirements. A few years ago, the Utah Ombudsman Program and Consumer Voice became very concerned that despite strong protections in regulation and law, inappropriate discharges and discharges that violated the requirements were the most frequent complaint made to state long-term care ombudsman programs nationally and also in Utah. And this was really quite concerning and troubling, since we know that improper discharges can have a really devastating physical and psychosocial effect on residents. So it seemed that these inappropriate discharges were in large part the result of a general lack of clarity and understanding around transfer and discharges. Next slide, please. So the purpose of this project was twofold. First, to help providers, ombudsmen, legal service providers, and other stakeholders to get a deeper and more comprehensive understanding of state and federal laws and regulations, the CMS guidance, which also includes PRODs and protocols, as well as the appeal process. So this was to be accomplished by creating a comprehensive resource manual. A few comments about the manual. It is designed to be a very straightforward compilation of the laws, regulations, surveyor guidance, procedures and protocols, what's called key elements of compliance from CMS, and critical element pathways. All of these things go with the survey. But to be a straightforward compilation of these elements that relate to transfers and discharges. So our hope is that this manual will be your go-to place whenever you have a question about the transfer discharge requirements, kind of a reference manual, if you will. I do want to point out what it is not. It is not a guide for providers on how to discharge a resident. So it's not a how-to. It's also not an advocacy guide for ombudsmen and other advocates. We sort of have been referring to it as just the facts, just the straightforward sharing of the laws and regulations. So that was the first purpose of the project. The second purpose of the project was to educate and inform residents and their families about their rights as they apply to transfer and discharge. So they understood their options, appeal rights, and what they could do and where they could go for help. So the idea here was to create a booklet that is consumer friendly, easy to understand, but to give residents and families the knowledge that they need to ensure that their rights are upheld and to get the help they need or to get their questions answered. Next slide, please. So I mentioned earlier that this project was done in coordination with the Utah State Ombudsman Program and supported by a CMP grant from the Department of Health and Human Services. So for that reason, we've asked Greg Bateman from the Utah Department of Health and Human Services and Allianne Sykes, who is the Utah State Ombudsman, to join us and to each say a few words before we launch into the program. So I'm going to ask Allianne to go first.
Thanks, Robin, and thank you everyone for joining us today. As Robin mentioned, this has been a project 3 years in the making. COVID set it back slightly, but it was still very much a much needed program or project to do. And we are very excited to be seeing the end results of this project come together. I want to say a big thank you to Consumer Voice for focusing on Utah and helping us create these wonderful resources for everyone to use now and in the future. Like Robin said, the focus and the goal for these resources is just to provide the facts and help break down both the federal and the state regulations and laws that revolve around discharges, so that we can all understand what they say better and how we can educate residents and families about their rights. Discharges do, like Robin said, they are among the top complaints that we deal with both on a statewide basis and nationally every year. So I'm very excited to be able to provide these resources to our stakeholders and most importantly to our residents. Thank you.
Super, thank you so much, Allie-Ann. And Greg.
Well, thank you, and thanks, Robin and Jamie, for taking on this project. It's been a couple of years in progress, but process and the project really well worth it. I know that in Utah we have 98 Medicare, Medicaid certified nursing homes, and this is an issue. There's a lot of frustration. I know that providers are frequently frustrated with circumstances that may lend to where they may initiate a discharge and questions about when is it appropriate, what are the processes they need to follow so that they do it correctly. So I think this will be a good resource for them, so that they do it properly. That's sometimes a struggle. I think that there are barriers to doing that correctly. And I hope that, and I didn't really get a good look on both the acute care side and the long-term care side. There's stakeholders on both sides that can benefit from hearing and learning from this process. So, look forward to the fruits of your labors. So thank you.
Thank you, Greg, and Allie-Ann as well. Both of you have provided wonderful help and support. It has been a long time coming because COVID, hit right in the middle, but we couldn't have accomplished this without help from both of you. So thank you so much. I also want to acknowledge a few other individuals. They include members of a project advisory council that we had, and that was a group of a really wide range of stakeholders that helped us shape the resources. There's also a small group of reviewers that I'd like to thank who went through the manual and the consumer booklet and provided us with really invaluable input and feedback. I want to introduce you to and acknowledge the phenomenal work of Jamie Freshy. So, Jamie, to say a quick hello. Jamie came on board sort of halfway through the project, and I will absolutely say this project, we would not be where we are without her. She has been just stellar. So Jamie is a consultant to Consumer Voice, formerly state ombudsman in Illinois, and I believe even before that, I think a local ombudsman. So Jamie is ombudsman extraordinaire in terms of her experience. So thank you, Jamie. And then I have to give a shout out to Daniel Musto, the former Utah State Ombudsman, who this project goes all the way back to him. So thank you, Daniel, for having launched the program to begin with. One quick note about the manual and the consumer booklet before we move on. We had hoped to have them available by today, but unfortunately we ran into some glitches. So at some point soon though, each nursing home, each regional ombudsman program, the legal services program, as well as a few other state government programs and agencies will receive a hard copy of the manual. And then the ombudsman program will be giving out the consumer booklets to residents, facilities, and resident representatives. Next slide, please. So the best way to find out when these materials are available and then to get copies once they are is to reach out to your local ombudsman program. So to get the contact information for your local ombudsman program, you can use the link on your screen. And we will be sending you these slides, so you'll have the link. So if for some reason you have difficulty connecting directly with your local ombudsman program, Alianne very kindly has said that you can contact her directly at her email address, which is listed on the slide. And additionally, both the manual and the consumer booklet, as well as the recording of this webinar, we believe will be available electronically on the Ombudsman Program website, which is indicated on the slide. That is pending final verification, but we're hopeful that it will in fact live on the Ombudsman Program website. So let's turn to today's presentation. The webinar will cover both an overview of the resources, so the manual and the booklet, and the transfer discharge requirements, as well as the appeal process. Both Jamie and I will be the presenters. In terms of logistics, all lines will be muted throughout the presentation. You can put questions at any point in time into the Q&A box that's on the control panel. And if we have time, we'll get to as many of them as we can. Not quite sure if we'll have time, but hopefully we will. As I said earlier, the webinar is being recorded, and the materials from this webinar, so the PowerPoint as well as the recording, will be emailed out to all of you in just a couple of days. So there's one last thing we have to do before we start the actual presentation. Our grant requires us to do a pre-test and a post-test so we can measure how much you learned from today's webinar. So I'm going to turn things over to Jamie, who's going to introduce the pre-test and then give you an overview of the resources created for this project. Okay, Jamie.
Thank you so much, Robin. And I'm going to extend my gratitude to you as well on your very diligent work on this project. So this really, truly would not be what it is without Robin's just amazing work on this. So thank you to her as well. Yes, I have been asked to conduct the pre-test. And Libby, could you go ahead and launch this? It's just 5 questions, true or false. And if you wouldn't mind taking just a few minutes to answer those questions, you will have to scroll down to see questions 4 and 5, but I'll give you a few moments to complete that. And when most of you have answered, we will proceed on with the rest of the webinar. All right, I'll give it just a couple more seconds. Looks like those of you who have answered or the numbers are slowing down. Okay, I'll go ahead and end the poll. And we will not be sharing these results. We are going to go ahead and wait until the end of the webinar when we do the post test. So thank you all for participating in that. I certainly appreciate it. Okay, next slide, please, Libby. All right, so as Robin mentioned, we have two main tools and materials for individuals to use. We have the consumer booklet, and I'm just going to walk you through the different information that we have provided within the consumer booklet. And then we have the resource manual, which is very comprehensive. I'm going to give you a very brief overview, more of an outline, and then Robin is going to touch on some really key concepts within the resource manual. As she mentioned, it is very comprehensive, and there's no way we can really cover all of it in a 1-hour webinar, but we wanted just to make sure that you had the crux of the information within those materials. Next slide, please. The consumer booklet is a guide for residents and their loved ones when the nursing home determines that they would like to discharge the resident. It is intended, as we mentioned earlier, for the Ombudsman programs to distribute to residents, their loved ones, so that they are informed of the process, residents' rights, and what their options are. So within that booklet, it does cover specifically what residents' rights are pertaining to transfers and discharges that are facility initiated. We also mentioned the 6 reasons for discharge. We give them information about the Utah Long-Term Care Ombudsman Program as a resource and as an entity to go to help them if they need an advocate throughout the transfer or discharge process. We cover information about the required written notice requirements. And we also give residents options that are spelled out to them. So some individuals may choose to stay. So we talk about your option of staying, or I'm sorry, choose to leave when a facility initiated transfer discharge has been issued, or some might choose to appeal that. And then, so we talk about what that appeal process might look like. And we also, at the end of the booklet, provide them with additional information and support, where to go to for legal services, for example, and again, how to contact the Ombudsman program and so on. And so that's just a really quick overview of the consumer booklet. Next slide, please. From here on out, we're going to talk about the resource manual. And again, this is a comprehensive resource on nursing home facility initiated transfers and just discharges to settings outside the facility. And I do want to stress that these resources are specific to nursing homes or nursing facilities. Okay, next slide, please. The resource manual is divided into 4 sections. The first section is just an overview of the transfer discharge provisions. The second section covers the federal nursing home regulations specific to transfer and discharge issues. Section 3 discusses the range of federal and state laws, regulations, federal regulatory tools, and how they apply to situations involving discharges. So this is a much more expansive look at not just the nursing home regs pertaining to transfers and discharges, but it looks at a whole slew of other regulatory tools and laws and regulations that in essence affect what facilities are supposed to be doing in terms of meeting residents' needs and a whole host of other things. And then finally, section 4 lays out the general fair hearing procedures for those in your state. Next slide, please. At the end of the resource manual, you have an appendix. There are several appendices, and we will be referencing those throughout the presentation so you can see how they coordinate with the resource manual. The appendices are tools that you can use separately. Some of them are checklists, some of them are tips, some are samples, and I'm going to go through them here in just a moment. But they are for your reference, but also if you choose to use them as tools outside of the manual. So the first appendix is the Utah federal regulations pertaining to transfers and discharges. It's a side-by-side comparison of the federal regulations and your state regulations so that you can see. In some cases, it may be confusing to folks if your state regulations are worded a little bit differently than the federal regulations, or they seem to be saying something different. We have it spelled out for you. And then we also have a column that lists what those differences are between the state and federal regulations. The second appendix covers information that's required to be conveyed to a receiving provider. So this is a checklist that nursing facilities can use when they are discharging a resident to another facility, just to ensure that you've covered your bases and that you have everything that is required of you from the federal regulations in terms of in terms of discharging to another facility. The next appendix is a directive or guidance from the Office of the State Long-Term Care Ombudsman. And as you, I hope, know, the federal regulations allow for state ombudsmen to indicate how they would like the notices received. And so there was a letter that went out, I'm not sure what year, it was when Daniel was still the state ombudsman, and gave the directive from the state office. So that is also included. Allie-Ann has signed off on that as well. And so new folks will also get this letter with this manual in the event that they weren't around when the first letter went out. The next appendix is a sample notice of transfer or discharge. It's a fillable form. Facilities can choose to use it if they wish. They can modify it, but the sample form that we've provided really covers all of the requirements under the federal regulations that are needed to be in a notice of transfer or discharge. So again, you can feel free to use that form if you wish. And finally, we have developed sort of a tip sheet, if you will, for completing the form to request a state fair hearing. It's essentially directions for a resident or anyone else who may be helping a resident file an appeal, that they could find that form online. It's a little bit confusing, and so we thought it might be helpful just to have some tips or directions for residents to fill out, to help them fill that particular form out. So that, we say initially that we have just 2 tools, but really there are several tools within the resource manual that should really help people within the nursing home long-term care network to assist them with understanding transfers and discharges and help them through that process. Okay, next slide, please. All right, I'm going to turn it over to Robin to cover the transfer discharge provisions.
Thank you so much, Jamie. So I want to give you all a very high-level summary of the federal transfer discharge provisions. So the focus is going to be on the federal regs, since the vast majority of the time, the requirements that must be followed in Utah that are related to transfer and discharges really are the federal requirements. And that's because Utah's regs are, for the most part, either identical to the federal ones or silent about what the federal regulations address. In the manual, when that is not the case, we have indicated that. So it's very clear when there's a Utah-only regulation. Next slide, please. So I think the best place to start is by defining just what we mean by a transfer and a discharge, as well as a facility-initiated and resident-initiated transfer or discharge. So I think in general, the easiest way to think about it is that a transfer and discharge are when a resident is moved to a bed outside of a certified facility. So as you know, facilities can be Medicaid certified, Medicare certified, or Medicare and Medicaid certified. But transfers and discharges are not the same things. So the major difference is that a transfer is when the resident expects to return, or it's expected that the resident will return to the original facility. While a discharge is when return to the original facility is not expected. Next slide, please. So a transfer or discharge can be either facility initiated or resident initiated. Facility initiated means that the transfer or discharge is one that the resident objects to. It did not come from a resident's verbal or a written request, and it's not in line with what the resident wants. It's not in line with what they've indicated are their goals and preferences. I do want to add that the surveyor guidance also says that if there's an emergency transfer to the hospital, that's also considered to be facility initiated. On the other hand, resident initiated means that the resident or their representative has given notice. So that could be verbal notice or written notice of their intent to leave the facility. So our focus in the manual and on this webinar is on facility initiated transfers and discharges. Next slide, please. The number one thing to know about transfers and discharge, and this is straight from the surveyor guidance, verbatim, that you'll find in the state operations manual, is this. Once admitted, the facility becomes the resident's home. For this reason, the expectation is that residents should be able to remain except under certain very limited situations. So as a general rule, transfers and discharges, and particularly discharges, should be rare. Facilities are expected to take steps so that a facility-initiated transfer or discharge is not necessary. Transfers and discharges should be the last resort, not the first resort, and should only occur when all other interventions have been tried and failed. So what are these very limited situations that this guidance refers to? So they are the 6 permissible reasons for transfer or discharge. These are the only reasons that a facility can discharge or transfer a resident. So I'm going to walk you through briefly each of these and then just highlight a few key points for each reason. So next slide, please. So this is reason number 1. The full regulatory language is the transfer or discharge is necessary to meet the resident's welfare, and the resident's needs cannot be met in the facility. So key points. First of all, before admitting any individual as a resident, the facility must really carefully assess the person and determine its ability to care for that individual. It should only admit residents whose needs it can meet. And why is that? Because after admission, a transfer or discharge should not be initiated unless the care and services and the needs of a resident have substantially changed to the point that those needs cannot be met in the facility. So in any situation where a facility believes it cannot meet a resident's needs, it has to first try to meet those needs before proceeding to transfer or discharge. So that is a process that, if you are working in a nursing home that you're very familiar with, but that involves assessing the resident, revising the care plan to include different interventions that stem from what you learned from assessing the resident, and then implementing the care plan consistently across all shifts. And that part I can't stress enough, because if it's not done consistently, it's not really being properly implemented. And that needs to be done on every shift, not just on the day shift, for example. So after the care plan has been revised and the new interventions have been implemented, the facility then needs to evaluate how those new interventions are working, and then continue to revise the care plan if it's still not meeting the residents' needs. So the key point is that really legitimate and meaningful attempts have to be made to meet the residents' needs. So this is obviously not a one and done approach. So in addition, the facility has to have evidence of those efforts, and there has to be documentation in the residence record of three very specific things. So the first thing that must be documented is the specific need or needs that cannot be met, what attempts the facility has made to meet those needs, and then why the receiving provider, where the facility is proposing to discharge the resident to, why that provider can meet the resident's needs while the facility can't. This is really important because all nursing facilities are required to comply with exactly the same requirements and provide the same care and services. So it makes you wonder, why would another facility be able to do that when the original facility cannot? So those points need to be addressed in the documentation. Next slide, please. So we're going to move on to reason 2. Full regulatory language. The resident's health has improved and the resident no longer needs facility services. So this reason is often given when a resident's Medicare coverage is ended. So I cannot emphasize this enough. The end of Medicare coverage is not a permissible reason for transfer or discharge, period. So when a resident's Medicare coverage for skilled services ends, that does not mean the resident has to be discharged from the facility. When a facility believes that the resident's skilled care coverage is ending, that the resident would no longer qualify for that, the facility has to let the resident know, has to give the resident a notice saying that they will no longer qualify for Medicare services. So there are, these are Medicare notices. There are 2 different notices: notice of Medicare non-coverage, and then what's called the Skilled Nursing Facility Advanced Beneficiary Notice. Lots of words there. But these notices are completely, these Medicare notices are completely separate from and unrelated to the notice of discharge from the facility. They are 2 completely different things. If you take nothing else away from this webinar, please take those points. A resident does not have to leave the facility after rehab. He or she may still need nursing home care and services, just not skilled care and services. So if that's the case, and the resident wants to remain in the facility, they can do so by paying privately or through another third-party insurer, such as Medicaid. This is simply a change in payer source, and that too is not a permissible reason for discharge. Next slide, please. So reason 3 is, and again, regulatory language, the safety of individuals in the facility is endangered due to the clinical or behavioral status of the resident. And reason 4 is that the health of individuals in the facility would otherwise be endangered. So first off, I want to point out that in reason number 3, that reason applies only in cases where safety is endangered as a result of a resident's clinical or behavioral status. So a transfer or discharge in which the endangerment is due to some other cause, would not be permissible. The scope of this reason is narrowed. We have combined these reasons into one slide because for both, prior to any discharge or transfer action, the facility has to assess the resident, revise the care plan, again, to try different interventions, implement those interventions consistently across all shifts, and then evaluate if the change in interventions addressed the health or safety concern. So I'm sure that language sounds familiar because it is the fundamental way that facilities should be trying to determine how best they can meet the needs and address a concern that may be arising, due to behavioral challenges, for example. One other key point is that if a resident is transferred to a hospital or other acute setting due to either of these reasons, the facility can't base its decision to not allow the resident to return on the resident's condition at the time of transfer. So the whole idea is that the resident was sent to the hospital or to the acute care, another acute care setting, in order to get care and treatment to address whatever was leading to the endangering behavior. So their condition after care and treatment should be different. And the facility has to evaluate the resident at that point before making a decision, not just based on the behavior or issue at the time of transfer. Next slide, please. So the language here is the resident has failed after reasonable and appropriate notice to pay for or to have paid under Medicare or Medicaid a stay at the facility. In order to discharge based on this reason, the regulations are very clear that there must actually be non-payment, not just anticipated non-payment. The regs are also clear about what non-payment is and what it isn't. So non-payment occurs if the resident doesn't submit the necessary paperwork for third-party payment. So for example, if the resident doesn't apply for Medicaid, when that would pay for his or her stay. So if they don't submit the paperwork, or if they do submit the paperwork, the claim is denied, and after that denial, the resident refuses to pay for his or her stay. So that is officially what is considered to be non-payment. So it is not non-payment if the resident has submitted a Medicaid application and is waiting for the decision, and it is not non-payment if the resident's initial Medicaid application was denied and the resident appealed that denial and is waiting for the findings of the appeal. Next slide, please. So the sixth and last reason is if the facility ceases to operate, which feels like it's pretty straightforward that there would be transfers and discharges at that point. But a facility may cease to operate involuntarily because CMS or the state Medicaid agency has decertified them, ended their participation in the Medicare and Medicaid programs, which basically translates into has stopped the funding. They may cease to operate involuntarily if the state survey agency revokes its state license, and a facility may also stop operating and close for a number of other reasons on a voluntary basis, and that most often is due to financial difficulties. Next slide. So all the reasons I've talked about have to do with transferring or discharging a resident from a facility. But remember, the definition of a transfer is that the resident is expected to return. And in general, the resident has the right to return. But if the facility will not permit a resident to return, at that point, the transfer becomes a facility-initiated discharge. And that means all the discharge requirements kick in. So the reason for the discharge has to be one of those 6 permissible reasons that I just covered. And the facility has to meet all requirements. And that means that the facility, among other things that it must do, has to issue a notice of transfer or discharge to the resident with copies to all the required individuals, including the ombudsman. So, at the point when the resident is not permitted to return, that is the point at which it becomes discharge. Okay, we're now going to look at some additional transfer discharge provisions, which Jamie is going to talk to you about.
Hi, Robin. And before I do that, there's one question that was pertaining to the Medicaid information on discharge. I thought you could answer very briefly. The question was, does non-payment include someone on Medicaid, but the facility does not receive cost of care? Oh, you're muted, Robin.
So by cost of care, I'm assuming that might be the portion that the resident has to kick in. I'm assuming that that's what that means. That term varies from place to place. So could you just say it one more time, Jamie? If the cost of care is not being paid?
The question is, does non-payment include someone on Medicaid, but the facility does not receive cost of care?
So the answer is yes, that could be considered non-payment. However, it shouldn't be getting to a point where the dollar, the amount is adding up. As soon as there is a problem or the facility realizes that the cost of care is not being paid, it should be talking to the resident or talking to the representative, whoever is responsible for paying the cost of care, and talking to them and making sure they understand what the requirements are and their responsibilities. So that's the first thing. You need to make sure that whoever is responsible for paying that understands the requirements and their obligations. So that's the first thing. The other point that relates to cost of care is there may possibly be times when that cost of care is being used for other purposes. And so basically the resident may be being financially exploited. So the facility at that point, again, as soon as there's an indication there's a problem, should be looking into it. And if it has a reason to suspect that might be happening, there's a duty to report it to the state survey agency and adult protective services. Sorry, long-winded answer.
No, that's okay. And there are a couple other questions, and I'm going to wait for the end because they're very good. And I'm going to I think we're nearing the end of our presentation, so I think we'll be able to get to a couple of those questions that are even along the same lines as this. So thank you, Robin. I appreciate it.
Sure.
Okay, some other regulations that we cover in the manual that apply are documentation requirements. And we're talking about documentation before, during, and after a notice is issued. Other key components include information to be shared by the receiving provider. We talked about having that tool, that checklist for you in the appendices. And in terms of the notice of transfer or discharge, we cover in your manual what information must be included in that notice and who is to be notified, when they are to be notified, how they are to be notified. And again, you'll find a sample of that notice in your appendices. The other key components is orientation and preparation of the resident to ensure an orderly transfer or discharge. We cover the regulations surrounding that. Bed hold, the notice of bed hold requirements for all residents in advance and prior to a transfer to the hospital for therapeutic leave. So we talk about both of those instances in which an individual would receive that notice of transfer or discharge. Or I'm sorry, the bed hold notice. The right to return to the facility from hospital or therapeutic leave. As Robin's discussed, residents have the right to return to the facility when they continue to require nursing facility services and if eligible for Medicare or Medicaid coverage of their nursing home care, even when the bed hole has been exceeded. So the right to remain pending an appeal is another key component that we cover in the manual. So if a resident has filed an appeal and on the facility's decision to transfer or discharge them, knowing that they have a right to remain in the facility until the results of the appeal have been determined. Next slide, please. The nursing home obligations pertinent to transfer discharge is the next section that is covered. This section talks about federal nursing home requirements that impact transfers and discharges that include federal guidance, protocols, the critical element pathways when applicable. And these regulations are significant because when they're not followed, situations may result in leading to an transfer or discharge that could have been prevented. And so as you see on your screen, we'll cover the residents' rights that included are what regulations actually impact transfers and discharge. So things such as refusal of treatment. And these are those difficult situations, I think, that come up often. Reasonable accommodation of needs and preferences, the right to self-determination, right to be informed, freedom from abuse, neglect, and exploitation. Next slide, please. And again, what regulations impact transfers and discharge. So even we dive into the regulations that cover special characteristics or service limitations, assessments. Robin's already talked about them somewhat. We get into more detail about assessments, the comprehensive person-centered care planning, discharge planning, nursing services and training, behavioral health services and sufficient staff to provide those health services, administration, including the facility assessment, and again, training requirements of all, well, the nursing staff, CNA staff as well. And finally, the last portion of the webinar is the fair hearing process, which I will turn over to Robin.
Thanks, Jamie. So as we've already stated, residents have the right to appeal a proposed transfer or discharge, although practically speaking, this is usually an appeal of a discharge for the most part. In the manual in section 4, we walk you through the appeals process and we give you legal citations for each step. Right now, what we want to do is just go over the general procedure so everyone has a basic understanding of how it works. Next slide, please. All right, so to start off, a really important point is that all residents, regardless of payer source, have the right to appeal. So residents have to be informed in the notice of transfer or discharge of their right to appeal. That notice has to include information about how they filed the appeal, and it has to indicate that they should be given help in filing the appeal if that's what they need. If the resident or someone on their behalf chooses to appeal, they must make a request for hearing within 30 days of receiving the notice. And the form that is used to file for an appeal is called, it's a really catchy name, the form to request a state fair hearing. Jamie mentioned this form a little earlier. A few words about this form. It's designed for Medicaid eligibility and services appeals, not for nursing home transfer and discharge appeals. So just as an aside, we at Consumer Voice really hope that all of you as a state will decide to create a form that is solely for transfers and discharges, because trying to complete this form for discharge appeals is, from my perspective, like trying to fit a round peg in a square hole, or a square peg in a round hole, or both. Nevertheless, it is the form that has to be used at this point in time. So to make it work, the Department of Health and Human Services, and specifically Greg, very kindly gave us some suggestions for how someone could fill out this form to indicate that they want to appeal a nursing home discharge. So you'll find those suggestions in Appendix 5 of the manual. It looks kind of like a little tip sheet. So we really hope that that makes this process easier and more understandable. Now, every resident who wishes to file an appeal has to use this form, even if they're not on Medicaid. Again, a resident can choose to have anyone they wish represent them, including an ombudsman. And there's a place on the form where they have to indicate who is representing them, if anyone. So that form then needs to be submitted by mail or email to the Utah Department of Health and Human Services, Office of Administrative Hearings, and all this information is in the manual. And again, the hearing request, as I said earlier, but just to repeat, has to be submitted within 30 days of getting the transfer discharge notice. That timing is very crucial. And if a request comes in after the date, it's not valid. So Jamie covered this earlier, but as a reminder, when a resident files a request for hearing, the facility cannot transfer or discharge the resident while the appeal is pending, with one exception, and that's if the failure to discharge or transfer would endanger the health or safety of the resident or other individuals. Talked about that earlier. In that case, the facility would need to document what exactly the risk is and how it determined that the resident could not stay in the facility. But after filing the hearing request, within that 30-day time period, a representative from the hearing office will notify the resident, as well as anybody who's representing the resident, of the date, the time, and location of the hearing. So this notification is given at least 10 calendar days before the hearing. So there's advance notice that this is coming up. Next, within 30 calendar days, I realize it sounds complicated, and again, this is all laid out in the manual, but within 30 days from the time that the hearing request is received, the hearing office must schedule what they call a pre-hearing conference, and that can be held by phone. So the purpose of this pre-hearing conference is to decide if a hearing needs to actually be held. So the hearing officer is there, both parties, so those representing the facility, those representing the resident, as well as the resident in the facility, discuss the factual, and the facts of the case, the legal issues of the case, look at what evidence there is, and then the hearing officer reviews the facts and the evidence and may decide that a hearing doesn't have to be held. Either way, the hearing officer at that stage of the game with the pre-hearing conference makes a decision. Yes, we're going to have the full hearing, or no, we don't need to have the hearing, and then all action stops at that point. If the case does proceed to a hearing, it's conducted by an administrative hearing officer who is impartial. The hearing officer decides where the hearing will be held, and usually it's held at the administrative hearings hearing room, and parties can attend in person or by telephone. And then at the hearing, each party has the right to present their evidence, rebut the evidence that the other side presents. You can bring witnesses, you can cross-examine, you can introduce exhibits. So it's kind of like a mini trial. After the hearing, the Office of Administrative Hearings then will make a decision and will send a written copy of that decision to each party or their representatives. And although it's important to note that there is no specific time frame for making that decision. And that's the appeals process in general, quite a high level overview, but I do refer you to the manual. We've been referring you to the manual, I did see that there was a question about, will you have a chance to look at it? As I said, it is not ready yet. It's in its final stages. We anticipate that it will be available soon. And as I said earlier, there'll be hard copies that will be given to each facility and certain other groups. It will also be available electronically. So the answer is yes, you will have access to the manual. Okay. Oh my goodness, we're running out of time here. Very quickly, it's time to take the post test. So again, there'll be 5 true false questions. All right. So Libby, if you could launch the poll. Okay, I think we'll go ahead and close the poll. Let's just run through and go over the answers really quickly. So transfers and discharges are essentially the same thing. So that answer is false. So looks like vast majority of people got that right. A resident must be discharged from the nursing facility when their Medicare coverage ends. False, 100%, yay. My work here is done, excellent. Let's see, next, except in emergency, a facility must first try to meet a resident's needs. 100%, that's absolutely true, fantastic. 4, a facility does not have to issue a notice of discharge when a resident is sent to the hospital, and the facility will accept the resident back. And that is false. They do have to issue a notice when a resident is sent to the hospital, and they're not going to accept the resident back. Remember, that's when a transfer becomes a discharge and the notice must be issued. And then last question, in general, residents have the right to stay in the facility during an appeal, and that answer is true. So it looks like you all did really well. I hope that this has been helpful. We are right at 4:59. Let's see if maybe we can, if you bear with us, and maybe we go just a couple of minutes over. Jamie, is there a question that you and I could answer together, or that you'd like to put out there for us to?
Well, I want to say I appreciate Allie-Ann and Greg because they've been answering the questions as we've been presenting. So I was just trying to scroll through to see if there was anything left unanswered, and there was one. I don't think we can really respond to it with a very short amount of time that we have with regard to Medicare and Medicaid. But Greg, I just see that Greg has responded. So they've done our hard work for us. So they're better.
Thank you. Well, Allianne and Greg, thank you very, very much. Really appreciate the pitching in like that. It was immensely helpful. So thank you. We're right at 5 o'clock, so we want to be respectful of your time. So in closing, I just want to remind you that the PowerPoint slides and the recording will be sent out shortly. We hope that you'll share the information with others who weren't able to participate today. Know that the manual and the consumer booklet will also be available soon. I want to thank Greg and Allianne, who I hope will show their faces one more time. I want to thank both of you for, as I said earlier, help and support during the project, and your help today in answering questions. Immensely appreciated. And then I want to thank all of you.
Could I just, it looks like in the question and answers, some of the responses may not have been, not everybody is able to see the answers. And would those be able to be sent to or provided to?
So I am going to ask Libby if it's possible for us to do that. And I have been remiss, and so I apologize. Libby Laubert has been helping us with moving the slides and all the logistics, and we could not have done this without her. But Libby, are we able to send the answers to the questions to folks?
Yeah, we can do that.
Okay, all right. Thank you for bringing that up, Greg. So we want to thank all of you for taking the time to join us today. And I think we all really hope that what we've presented today on the webinar, along with the manual and the booklet, really help ensure that discharges in Utah are rare, and that when they do occur, they're safe and uphold residents' rights. So thank you again, and enjoy the rest of your day.
Thank you.